This research rundown is titled Hyperbaric Oxygen Therapy as a Potential Treatment for Post-Traumatic Stress Disorder Associated with Traumatic Brain Injury, the topic that we've been covering with the soldiers. And it does focus on the soldiers. I like to jump to the conclusion. And in this conclusion, we'll just cover that briefly here. There is considerable evidence that some beneficial effects of Hbot for treating traumatic brain injury and PTSD in animal models, although this does not seem to have translated to human clinical trials, is what they point out. This may relate to problems with appropriate controls of other factors rather than the lack of efficacy. It is therefore timely to perform Hbot in an animal study for TBI and PTSD to determine the optimal treatment regimen if we want to treat rats and cats and dogs. Didn't actually say that. And then it talks about this prophylactic use may be of benefit and help because it helps minimize inflammation and does encourage neurogenesis. So looking at the conclusion, I would say that it's quite interesting. It's recommending animal studies. This is, by the way, one of the other things I think that's important to look at in these papers is the acknowledgement. So who's funding it? Where is the funding coming from? And then the disclosures. And here it says the authors report no conflicts of interest in this work. So who is funding this? And it ends up it's the Neurosurgery and Brain Repair Group out in Southern Florida University. So there's nothing to see there. I mean, there's no conflict there from surgeons looking at oxygen and pressure. And I looked through the studies that they reference, because there's a list of studies, and it's a nice little list. Most of these studies for human beings, they're recruiting. So you see they're recruiting people. So you might call them up and say, hey, I'll volunteer, and maybe they're going to treat you for free under some protocol. So they're still recruiting, and some of these studies have been out there for many years. And apparently they can't find people with any type of TBI or PTSD. So those seem to be longstanding, I would say, excuses for not completing a study. Another interesting thing is that although we want to go back to animals for PTSD and TBI, and the study clearly points out that we're just not sure if they're related. I just talked to somebody with a TBI that ends up being diagnosed with PTSD and put on some medication. And you can quickly find out that there is definitely some relation to it. We may find that mechanism one day, but if it was me with a TBI and I had PTSD, I would jump in a chamber based on everything I see here. But interesting, the studies sort of tail off into autism. Okay, that's not what the title says, but what's interesting is autism gets high marks here. That every study, I think there's 6 studies here for autism, shows that all these autistic kids see significant improvement. And so it's a deflection. Why are we deflecting against or away from TBI and PTSD? That's what I get out of this study. It's unfortunate. There are some really good studies out there, I think, that we should focus more on and not try and come up with what's the problem with hyperbaric oxygen studies where we really can't define what is the placebo group, or the sham. They call it one or the other. And so it spends a lot of time on trying to determine what is a placebo when it comes to hyperbaric oxygen. Are we eliminating the oxygen, eliminating the pressure? If we have one or the other, is it truly a placebo? So it's really difficult to define this is the placebo group. So if you've been in a chamber, and how do we fake that there's any pressure? And so maybe all of it's just up here. But again, if it was me and I had a TBI and a PTSD, I might not really care if there was a placebo group that was defined. But anyhow, the paper's out there, and we're going to list it. We'll put it right underneath this little brief. And I hope you take the time to understand that a lot of the studies out there, to me, Again, there's no conflict of interest, that there may be just, some reason to kick the can down the road. So let's keep an eye out for that when we look at studies, because a lot of studies do conclude more research. Not all of them go back to animals, because I don't understand why that, because there's a lot of studies here with humans. Why are we going back to animals? Because we've already proven in these studies that it's safe for humans. So why are we looking at animals again? So anyhow, when you see them pushing in that direction, just be aware. Thank you.